Navigating the dashboard. Here is a demonstration of the Search and Save Medicare Quoting and RX List Saving system. Once you log into the system, you will come to the dashboard. On the left-hand column, you will see the Customer Profiles icon. This button will always take you back to the dashboard. The SOA icon, which will link you to our electronic scope of appointment system provided by CSG. The video icon will take you to our page of self-help videos for the system. At the bottom of the page, you will see a button titled Support. This will allow you to submit a help ticket request to us if you have an issue. All customer profiles are shown with a list ID number. These list ID numbers will keep your book of business anonymous, secure, and encrypted. The system will display the agent's name who created the customer profile, the date it was created. There is a button to view the list, to make updates or changes, and a delete list button to remove a customer profile. Recently viewed profiles are in the right-hand column to make for easy retrieval of customer profiles that you may have been working with. When you click on the Consumer Profile tab, you will see a button marked Customer Profiles by Drug Name Lookup. This tool will help you look up specific customer list by prescription name. You will use this when a carrier changes or eliminates coverage for a prescription your client is on. This will allow you to quickly find those clients and handle the situation. Type in the prescription name. All the customer profile lists with that prescription will populate. Simply click on View List for the specific profile you need to review. You can download these lists into an Excel spreadsheet to show you the list number, who created the list, prescription matches, and the date the list was created. You can also search multiple prescriptions on this tool as well for a client. Drugs entered into the list are easy to edit or remove. This tool will show any list that is shared, or if you are the administrator of the system for the agency, you can search all lists. Creating a new list. To create a new list for a customer, simply click the green button titled Add New List. We did include an important safety feature, the ability to create a custom identifier for the customer profile ID numbers. The custom identifier and the ID number are kept on a separate server. A screen will appear asking you to create a custom identifier for this customer's ID number. You can use anything you like, even the customer's name. It is very important that you make note of the ID number for the list. Place this ID number in the customer's file or their profile on your CRM system or both. We use anonymous list ID numbers to keep your book of business secure and keep subscription costs low. You create a custom identifier for the list you created. The list number and your custom identifier are saved on a separate server in case you lose your files or did not add them to a CRM. To retrieve your custom identifier information for each list ID number, simply click on the List Identifier Request button. Then click Yes, Send It when the Send Recovery List drop-down appears. We will send your list numbers with corresponding custom identification to your email on an Excel spreadsheet. You have now created your customer profile and can start entering information. To begin, enter the zip code, county, and plan year, and if your client is receiving any low-income subsidy. The system allows you to add notes to the customer profile. We do ask you not to include any customer profile notes information that would violate HIPAA, PH1, or PH2 rules. Click Update Profile. You can now move to any of the other tabs you need to in our system. For our demonstration here, we will take the tabs in order. We get all of our prescription information from Connect Your DRX Medicine Cabinet. They are the gold standard for Medicare prescription data. Fill in the prescription name. In this demonstration, we will use Lipitor. There is a selection of boxes for the medications. You enter the number of pills or units, dosage, and frequency. When you enter a brand name drug, such as Lipitor here, if a generic for the name brand drug exists, a generic alert will appear. If a generic alert appears, the generic drug will appear just beneath the alert. Prescriptions come in many types of packaging. It is critical that you enter the correct packaging of the prescription to give the customer the most accurate estimate on the quote. Our system will drop down menus of all the different types of packaging, so to make seeing and selecting the correct prescription is available for you. We will replace the brand name drug here with a generic to illustrate how this tool works. I want to point out another great feature of this system, the action button. Our system makes edits quick and easy, so to save you selling time during the peak periods of the year like AEP. Our system saves your client's prescription list year after year. You can easily make updates and changes using the action button. In our demonstration, let's say it is now the next year, and your client tells you there is a change of dosage on their prescription. It's easy to go in and make the edit. This client's prescription list is now updated, and you are ready to look at quotes. We improved pharmacy selection. You can choose up to 3 pharmacies. You can search pharmacies by name or zip code. You can search pharmacies up to 85 miles away. Search results will populate on the map. If you click on a pharmacy on the map, you will be able to get directions to it. When you select the pharmacy to add to your customer's profile, that selected pharmacy will turn green to show it was selected. Search and Save includes Blue Button technology provided by CMS. You must have authorization from the client to use Blue Button technology to download their drug list information. Here is the process to do this with Search and Save. Once you have created a new list, or you are working with an existing list, go to the Pharmacy tab. You must enter the pharmacies here first before you use CMS Blue Button to access your client's drug data. CMS will not return the drug data unless you enter pharmacies first. You have now entered your pharmacies. Click on the CMS Blue Button tab. Next, click on the blue button. An authentication request drop-down will appear. Enter the customer's name and email address. Security warning. You cannot send this request to yourself. Search and Save has disabled the ability to do this as per CMS guidelines and to ensure beneficiary security and privacy. Your client will receive an email from MMQ support asking for authorization to access the information. The email shows the agent's name, the client needs to click on the Authorize My Medicare Account button. When they do this, it will take them to the Medicare.gov login page. The client will allow your access there. They will see the success screen, and the client is finished with their side of the process. Once the client completes these steps, the agent will receive a confirmation email from MMQ support. The email will include the list ID number for reference. Click the Login button to go back into Search and Save. Reload the client's list. You must reload the list for it to populate the client's drug information. Important reminder, please confirm the drug list with the client. CMS says that due diligence is required by the agent on the information downloaded for accuracy. MAPD and PDP plan. You will see the plans populate. There are 3 toggles to the left-hand side next to the different filters. You can easily switch results between MAPD, standalone PDP, and MA-only plans. We have added filters for carriers, column headings, and insulin savings. The column filter has 14 different data points that are available for you to customize what data you wish to illustrate. You can create and change any combination you wish for each client. The carrier filter is for all available carriers selling MA plans in the customer's zip code and county. You can show the ones you want to or show all of them. It's your call. The insulin savings filter. Is your client a diabetic? You can filter plan results to show just the carriers offering insulin savings plans. Each plan result will have a checkbox next to it. This allows you to do side-by-side comparisons of up to 3 plans. Check the boxes next to the plans you wish to compare. Click the box marked Compare Selected Plans. A side-by-side comparison will populate. You can print out this comparison and give it to a client or email it to them. Both are CMS approved for client use. Click on the View button for any of the plans you wish to get the plan details on. On Plan Details, you can switch back and forth easily, and you can open as many plans as you wish to review. The plan detail displays will show you several easy-to-read boxes titled Monthly Plan Premium, Prescription Deductible, Estimated Mail Order Copay, Total Drug Copay, Total Premium, Total Estimated Cost. Pharmacy details will show a color-coded legend with yellow equaling preferred pharmacy, gray equaling standard pharmacy, and red equaling out-of-network pharmacy designations. You can see the pricing effect of each of the pharmacies you selected by clicking on their tabs. Mail order is here too. The plan detail displays prescriptions in a table format that corresponded with an estimated cost month-by-month breakout below. There is an important toggle switch marked Show Remaining Months Drug Cost Only. When you activate this toggle, it will only display the months left in the plan year, including drug and plan premium. If you wish to show the entire plan year cost, simply deactivate the toggle. We have subtotaled each month and added a rolling total column to make it quick and easy to show a customer their out-of-pocket cost on prescriptions with a separate line item for monthly plan premium. Labels on the table match the labels on the estimated month-by-month breakout. We did this so to make your client's presentations easier and more understandable. The medical plan details are listed here below the prescription information. Document links are here for your convenience. The print button for these plan details is easy to find and clearly displayed. Agent Portal buttons. On the Medicare Advantage and PDP plan quoting pages, you will see buttons labeled Agent Portal on the right-hand side. When you click these buttons, they will take you to the carrier's Agent Portal login pages. There, you can log in with your portal credentials as a contracted and certified agent for the carrier's plans. Once you're in the Agent Portal, electronic applications, if offered by the carrier, or PDF downloads of forms and applications will be available to you to complete the client's enrollment. These agent portals make it easy to access the carrier's platforms and materials for enrollment. If you don't see an agent portal button, it means the carrier does not offer one. Please remember that by doing your enrollments on the carrier sites, you will have access to earning HRA, Health Risk Assessment, commissions that are not available currently on most third-party enrollment sites. Provider and Facility Search Engine. This is the part of our system that will save you the most time in searching and comparing Medicare plans for your clients. Our Provider and Facility Search Engine is the finest ever built in our industry. We all know that searching for clients' prescriptions is very time-consuming. But just as time-consuming is the search to see which plans take which providers. Once you get the list of providers from your client, you then navigate each carrier's network directory. Most are hard to work with, but in any case, having to open each plan's provider network is very time-consuming. Our provider information comes to us directly from the carriers via our data vendor and is updated weekly. You will be able to look up providers and facilities across MAPD carrier-specific plan directories in one place and be able to save your results to reference for your clients year after year. You will see the fields to enter the information to search for providers. The minimum required information to make a provider search is name of the provider and the zip code. We will search for Dr. David H. Stern in zip code 90501. The search engine will then display PCP number, name, address, city, state, group name, and what MAPD plans the provider takes. The more information you enter for the provider, the better, as providers sometimes take different plans at different locations. You can also do a search radius of up to 25 miles if needed. The provider search engine will check your customers' providers against the plans you selected and show you what Medicare Advantage plans they accept. You can do the same operation for facilities to know what plans honor certain facilities. Simply click the Save button to save this provider to this customer's profile from year to year. Medicare Supplements. Our system allows you to quote Medicare Supplements coast to coast without contract restrictions. You can use our carrier filter and select the carriers you wish to see. You will see data fields required to do your quote: age, gender, tobacco use, zip code, county, plan, and effective date. Click Find Plans. The plans will appear by lowest monthly EFT amount. Also displayed are rate type, loss ratio, AM Best and S&P ratings if available, lives covered nationally, pricing for quarterly, semi-annual, and annual premium payment. If a policy fee is charged, it will be listed. Printouts are single-paged and can be saved as PDF files for emailing. You will see a link for e-application for any carrier that offers such a platform to agents. Click on the link and go straight to the carrier's login page to access their e-app. Ancillary Hospital Indemnity and Final Expense. On the dashboard, you will see the Ancillary Products tab. Click on the tab to select Hospital Indemnity or Final Expense plans. Let's start with Hospital Indemnity. On the quote screen, you will see the zip code populated from the profile you created. Enter age, sex, tobacco use, then click Find Plans. The plans will populate, and you can then adjust the results if desired. You can change the monthly indemnity benefit or the monthly cost. Optional benefits are there for you to choose from if needed. Skilled nursing facility, ambulance, ER, outpatient, surgical center, labs and radiology, lump sum hospital confinement, outpatient surgery. The price for the plan will automatically update when changes to benefits or optional benefits are selected. You will be able to print out the proposal on paper or save and send to a client electronically as a PDF. We included a carrier filter so you will be able to view the carriers you prefer. The ancillary tab also allows you to quote final expense plans. The zip code is auto-filled from the customer profile you created. Age, gender, tobacco use, face amount, product type, underwriting type are needed. Then click Search. As the quotes are displayed, you will see the monthly premium, monthly fee, carrier, parent company, plan name, AM Best and S&P ratings, underwriting designation. Click on the icon to see plan specifics. You can print out the quote on paper or electronically in a PDF file to email to a client. We also offer a comparison feature for up to 3 selected plans that you can also print out or save as a PDF. There is a carrier filter which will allow you to save the carriers you use most, if needed. Adding a sub-user. If you are the administrator of your account, click your profile picture in the upper right-hand corner. Select Account Settings. You will then see tabs open up on the Account Settings page. Select the My Users tab. As the account administrator, only you will see this tab. Next, click on the gear icon and select Add User. A drop-down screen will appear, where you will fill out the agent's information. Once you added the new user, an email will be sent to them. Have the new user click on the button on the email titled Set Up My Login Information. The new user will go to a screen to update and confirm their password to access the system. Once confirmed, they will go to the home screen of the system to start using it. List sharing. As the administrator of the account, you will be able to allow list sharing of other users. Click on your profile picture. Select Account Settings. Select the My Users tab. Your sub-users will display here. There is a gear icon next to each of the user's profiles. When you click on it, a drop-down menu will appear, allowing you to control share options of the user's list, resend the email invitation invite to the user if needed, edit the user's information. When you select Share Options, a menu will appear that will ask you who you want to share the selected list with the user. Click the boxes on who you wish to share the user's list with, then close. If you need to remove a user, click the Remove button. When you remove a user, you can assign their list to whoever you desire. A drop-down screen will ask you who to assign the list to. If you're an agency and have 2 or more users on the system, you will see a tool marked List Owner. This is a great tool that allows for the administrator to assign ownership of a customer list inside their agency. This will allow administrators to assign list ownership for printout purposes, to show the agent's name instead of the support person, and more. It will help in the case of agents or support staff being out due to illness, maternity, or leave of absence, etc. Administrators will now be able to change ownership on list without having to delete a user. There is a Billing History tab for the administrator. If needed, you can adjust your account type and change the level of user license needed. Select the gear icon. There you can update your credit card for subscription fees or cancel the account. Sub-users can share their list. The sub-user clicks on their profile picture, selects Account Settings. There you can select the other users you wish to share your list with by clicking the boxes in their profiles. Under My Profile, you can update your name, phone, and website information by simply hovering over the title of the area you wish to edit. Any other information you wish to be updated there would need to be completed through your account administrator. Would you like to try out this system? It's easy. We'll give you a 30-day free trial of the Search and Save system. No credit card is required, and you can start using it now. You can create an account by using your social media login from LinkedIn, Facebook, or Google. Don't use social media? No worries. Click Register. Enter your name and email. Create and confirm your password. Then click Register. We will send you a confirmation email that will come from MMQ Support. Simply confirm your registration on this email. Go back to the login page, log in, and you're ready to start using Search and Save. As you're testing out the system, you will see a pop-up screen that will count down the days left on your trial period. Love Search and Save? Want to go ahead with the billing? It's easy. Just click on Billing, select the type of agency, single, small, medium, or large, and add your payment. To eliminate any confusion when you review your credit card statement, the billing for the Search and Save system will come from our corporation named One Too Many Insurance Agency Incorporated. Sorry, but I have a sense of humor. Thank you for watching this video on the Search and Save system, least expensive and most comprehensive Medicare system for agents to use in the industry.